So we can today very common gynecological problem. What is this? Utero Vaginal Prolapse. Utero Vaginal Prolapse. You know what is the meaning of the prolapse? Come down, yeah, this displacement, or the term came from the procedentia, that is Latin word. That means to fall down. So fall down of any organ, that is called prolapse. Prolapse, it can not only uterus, so many different organ may be prolapse. You know the Gynae, there is some prolapse, you know what? There is a class taken? Yeah, there is so many organ may be prolapse from its normal anatomical position. Okay, so it is maybe prolapse, may be downward displacement, lateral displacement, or upward displacement. It is prolapse is now in our uterovaginal prolapse, that is pelvic organ prolapse. I will tell about the uterovaginal prolapse, that is downward displacement of the uterus and the vagina. Okay. Now you know from the pelvic organ anatomy, there is if you divide the pelvic organs in three compartments, that is anterior compartment, middle compartment, posterior compartment. I think you know. Anterior compartment, there is urethra. If it prolapse, it is known as urethrocoel. If the bladder is anterovaginal wall prolapse, then it is called cystocoel. Okay? And middle compartment, that is uterine as a whole prolapse, that is uterine prolapse. And you know the uterine prolapse cannot be occurred alone, only uterus. That is, it is always associated with upper part of the vagina, upper part of the vagina. And another is, what is this? And vaginal prolapse, it can occur alone. Anterior vaginal wall prolapse, that is cystocoel. Posterior vaginal wall prolapse, that is rectocoel, as it is associated with always with the rectum. Anterior vaginal wall prolapse is bladder wall, so that is called cystocoel. And posterior compartment descent is called rectocoel. And middle compartment is associated with enterocoel. Sometimes it is called the posterior compartment defect, but it is the middle compartment defect, the enterocoel. Okay? Vaginal valve, through the valve, that is pouch of Douglas. What is pouch of Douglas? The space between the rectum and posterior vaginal, that is posterior fornix. That is pouch of Douglas, the space just above the posterior vaginal fornix. So through the posterior vaginal fornix, it is the enterocoel. Okay. Now you can imagine better. I can show on the picture, so that you can understand now. What is written? At 62 years, that is postmenopausal, women can, that is, complain of low back pain and, tell me, perineal pressure for 1.5 years. She has been prescribed a pessary which she is reluctant to wear. All pelvic examination as second degree uterine prolapse with cystocoel and rectocoel is observed. So from this view, that is 62 years, that means postmenopausal. If menstrual cycle is stopped, then what is the problem? There is estrogen deficiency. There is ovarian failure, so there is no formation of hormone from the ovary. That is, estrogen is one of the important hormone that supports the different pelvic cellular tissue, collagen tissue, to hold any organ to its normal position. All of us know the supports of the uterus. What are the supports of the uterus? upper, middle and lower. Upper supports at first you know the pelvic fascia is one of the important supports, pelvic cellular tissue, one of the important supports. And you think that uterus, if you think that is broad ligament, round ligament, upper support. Middle support is strongest support. Middle support by the anteriorly what? Macandros ligament, and posteriorly uterosacral ligament. Can you memorize now? Anteriorly macandros ligament, posteriorly uterosacral ligament. That is the strongest support. And lower part by the pelvic floor mostly. And there are other supports also. The position anteriorly flexed uterus. Uterus at the level of the internal os, it is 45-degree angle flexed. It is the supports. So all the supports are relaxed in the postmenopausal period. You know the congenital, if you now I can tell what are the factors actually, that is activating factors. Another is predisposing factors. So predisposing factors are congenital and development weakness of the pelvic supports. There may be sometimes. And another is there is some, how can the supports can be weak. Another, you know that if chronic cough, there is predisposing factors also. Chronic cough, more intra-abdominal pressure, more lifting of the weight, so that it causes the weakness of the supports. But in our country, most of the important is the vaginal birth, that is uncared, unskilled hand. Most of the vaginal delivery is by the unskilled hand still. That is, suppose without a full dilatation of the cervix, most of the midwife or they told give more pressure. So if before full dilatation of the cervix, if you tell the patient to bear down more, then it causes unnecessary stretching and injury to the supports of the uterus. So, and repeated vaginal birth, if without care and without contraceptives and repeated vaginal birth, without proper rest, at least 2 years needed for to regain of the strength of the all structure after one delivery. So if without proper rest, that is at least 2 years after one birth, again conceive, again vaginal birth, so there is weakness. Okay. Another is perineal tear. If there is perineal tear and not repaired in oil, then also relaxed perineum also associated with the prolapse. Okay, these are the etiological factors of the uterine prolapse. And now, so anatomical knowledge is important. You see this one. So that is anterior compartment, middle compartment and posterior compartment. Okay. So if they all are supported by the pelvic, some cellular tissue or pelvic fascia, so there is weakness of this organ. This angle also one of the support. You see there is normal position. Here the uterus is normal position and it is going down. Okay. That is, if it is completely outside, then it is called procedentia. If it is in just displacement but within the vaginal cavity, early stage. If it is in between the hymen and the that is external os level, that is ischial spine level, then it is called second degree. So there is first degree and second degree and third degree of the uterine prolapse. You know that if cervix, that is cervix, external os and internal. If external os level displaced but near the level of the internal os, first degree. If it is near to the vaginal introitus, then it is second degree. If outside the vaginal introitus, then it is third degree. Most common is second degree uterine prolapse, second degree. It is most of the time that is extended second degree uterine prolapse. Extended, this is, you saw this one. And always, most of the time associated with, it is ulcer. Sometimes associated with ulcer. It is one of the complication of the uterine prolapse is decubitus ulcer. Now you are asked in the question how this ulcer is formed. How this ulcer is formed? Can you imagine? That is called decubitus ulcer. Okay, and this is one of the complication. Number one complication is the keratinization of the vaginal wall. How keratinization? If any internal organ comes out, then by the external environment more irritation, and as a defense mechanism the epithelial changes and goes into keratinization. So number one is keratinization, that is pigmentation. You saw sir, pigmentation, okay, pigmentation of the epithelial surface. Another is decubitus ulcer. Why decubitus ulcer? It is always asked in the exam, and what is the management of the decubitus ulcer? Listen all, how decubitus ulcer, that is very interesting. You cannot think that is due to infection, okay, not due to infection. You see, if there is displacement from the normal anatomical position, downward displacement, so circulation will be hampered or not? So blood circulation will be hampered. If there is lack of circulation, that is called ischemia. Very good. If ischemia, then there is necrosis, and if there is necrosis, then there is sloughing out of the tissue, and in this way ulcer is formed. Okay, so downward displacement and normal anatomical position, that is normal circulation is hampered, and it causes local changes by ischemia. There is edematous change, and also there is injury to the epithelial cell, degeneration, necrosis, and then sloughing out of the tissue, and then ulceration. Do you understand, everyone? Everybody is asked this question. So now what would be the management? Normally তুমি চিন্তা করো কি ম্যানেজমেন্ট হবে, এটা একটা অর্গান তোমার নিচের দিকে ঝুলে গেছে, সেটা তুমি কি করবে এখন? উপরের দিকে উঠায় দাও। সো রিপ্লেসমেন্ট, রিপোজিশন অফ দ্য ইউটেরাস। তো তুমি উপরের দিকে উঠায় দিলে তো থাকবে না, তাহলে সাম ভ্যাজিনাল প্যাক দিতে হবে বা রিং দিতে হবে, রিং প্যাসারি দিতে হবে। সামটাইমস দ্যার ইজ রিং প্যাসারি। So you should give something in the vaginal cavity. If you displace again upwards, and you should keep something in the vagina, otherwise it will again come out. So we give something vaginal pack. Sometimes we soak with the acroplebin or some antiseptic lotion or liquid, and then patient or by some pessary. And patient should lie during this management most of the time. And at least it takes 2 to 3 weeks for epithelialization. Okay, what are the other changes in this uterine prolapse? You know the cervix, there is a glandular secretion from the endocervix. So sometimes there is more secretion, so more watery discharge, more sometimes infected discharge also. And you know if cervix is downwards, uterus always try to bring up the uterus by itself. So there is in the region of the supravaginal cervix, there is hypertrophic elongation of the cervix. As uterus always try to bring the cervix, so there is hypertrophic elongation of the cervix. So there is abnormal uterine discharge, decubitus ulcer, and hypertrophic elongation of the cervix. If you think that uterus is downwards, and at the lateral side there is the ureter, okay, there is ureter. You know the second Bladder, anteriorly, bladder. Posteriorly, parts of Douglas and the rectum. So, when the uterus is down, you know the uterine artery, there is a relation between uterine artery and the ureter. নদী মানে দ্যাট ইজ তোমার নদীর উপর ব্রিজ, তার মানে কি নদী মানে ইউরেটার আর ব্রিজ মানে artery. So you always remember this. It is near to the at the level of the internal os. So there is a relation.